Welcome. Welcome back. We are so excited. Please open your calendars and save the date. July 8th at 6:30 p.m. until 7:15. So 45 minutes of our special guest, Dr. Tom Culleton, is going to be in town. He is a chiropractic neurologist. He is our mentor. He is someone we've studied with for decades, and he's brilliant. He's a phenomenal speaker, and he's committed to making a difference in the world. So have you ever wondered what your lab and blood work says and how to read it? He's the one. He's the one to explain these things to you. He's the one that you just want to be there. He's phenomenal. And many of the medical doctors aren't doing what he does.
Yeah, he basically, rather than guess with your health, you get to finally test with your health. Mm-hmm. So if you're wondering, is this vitamin D supplement or this B12 or this B vitamin or whatever vitamin you're taking, is it really working for me? So what this is going to be about is finding out, how, based on lab testing, is this necessary for me to take? Whether they're supplements, whether it's medication, or any other kind of nutraceutical. We're going to show you and explain to you the importance of lab testing, but more so from a wellness standpoint.
Right.
Yep.
So again, July 8th, 6:30 p.m. until 7:15, right here at our office, 8540 Southeastern, number 210.
And there's no charge for this, so come on in and learn something. Something maybe you haven't heard before, or something unique, and and bring your questions. We encourage people to ask questions and your curiosities as to how this kind of lab testing can help you in your day-to-day wellness versus getting a lab report telling you what drugs need to be on. Wouldn't it be nice to test for your nutritional health versus what drugs you need to be on that are just another poison you're putting in your body?
Mm-hmm.
Yep. So anyways, come on in, learn a lot more about how you can not only get healthy, but also stay healthy.
Right. Okay.
Go ahead.
Okay, so today we're going to talk about the difference between SoftWave and other Shockwave modalities. Go ahead.
Sure. So, the first one is, what's the mechanism of action here between what we use is the SoftWave tissue regeneration technology. It uses unfocused, low-intensity sound waves to stimulate tissue repair, okay? Versus shockwave therapy, I want you to read that one.
Shockwave therapy is more focused. So if we look at focused versus unfocused. So unfocused is going to cover a larger area and penetrate deeper, causing more healing.
Right. So with shockwave therapy, what it does is it uses high intensity sound waves to break down scar tissue and calcifications. It's more of a focused wave. What is the treatment depth? Well, the treatment depth for SoftWave is about that of a soup can. Okay, it can get down there. It targets both superficial and deep injuries.
Mm-hmm. And Shockwave is superficial to medium.
Yeah, medium depth tissues.
Medium depth tissues.
Okay, good. The intensity, low intensity, it's very gentle on tissues. Mm-hmm. for SoftWave therapy.
Right. Shockwave can be high intensity and more aggressive, which you might not.
Yeah, and because it's more aggressive, there's a possibility of causing agitation to the tissue. Mm-hmm. So with SoftWave, it does not cause any agitation. It is actually all good. Mm-hmm. Mm-hmm. As far as the treatment areas goes, SoftWave covers a larger area.
And Shockwave is localized, more specific on spot treatment.
The pain level during treatment with SoftWave is generally painless, more or less comfortable for the patient.
Right, and with a Shockwave, it can be painful and may even require anesthesia. Local.
Yeah. Side effects, minimal to none, very low risk of side effects all with SoftWave.
Potential bruising, swelling, and pain post-treatment with the Shockwave.
Yeah. And typical applications, it's used for chronic pain, tissue regeneration, and a lot, especially lately, inflammation reduction.
Right. Whereas Shockwave only is chronic pain, tendonitis, and calcifications. So different.
And how many treatment sessions? Typically, usually fewer sessions are needed with longer lasting effects. We've noticed with the SoftWave.
Mm-hmm. And the Shockwave may require more treatments, more for musculoskeletal conditions.
And usually what we do with SoftWave, we recommend a small course of care. Just basically see, because everyone is unique and different, so we want to treat you that way, but we recommend not so many, doesn't have to be like a lot of visits, but just a certain amount that can be done in less than 8 weeks.
Mm-hmm. We just had a woman here before lunchtime, and she literally came limping in. Her knee was about a pain level of an 8, and she was so happy with her results after one session of the SoftWave. Plus, Dr. Chris is highly skilled at extremity adjusting, so she was thrilled. She's coming back for her second treatment before she leaves for an international trip.
And that's kind of the neat thing about this, because the recovery time with SoftWave is little to no downtime. It's very quick, very quick recovery.
Whereas with the Shockwave only, it could be possible downtime due to pain and some of the side effects we mentioned.
So it takes longer. As far as FDA approvals, the SoftWave tissue regeneration technologies is FDA cleared for pain reduction and improved blood supply.
And the Shockwave therapy is approved for certain musculoskeletal conditions.
Musculoskeletal conditions. It's a tongue twister, isn't it? So let's talk about the true benefits of SoftWave tissue regeneration technology. Just to start off here, one is increases blood supply. Okay, it increases, actually, when we apply this to our patients, we're increasing the blood supply by almost 300%. Okay, it also decreases inflammation, stimulates and activates resident stem cells. Okay, so it's like we're waking up these cells to start working again, repairs and remodels, as well as regenerates damaged tissue, accelerates wound healing, also induces an antibacterial effect. And lastly, it reduces acute and chronic pain. So you don't have to be someone that's had long-lasting pain, but it could be for, if I just got injured, to something that's maybe arthritic or chronic in nature. So we've been having a lot of fun with people, and a lot of fun helping people anywhere from their teen years, to their senior years. So it's perfectly safe for that.
Right, it's safe to, for the most part, you don't need to have downtime. And many times we have elite athletes that want to get back on the court, back on the course, back in the game, and that's why we're here.
Well, see, the other big question is, how long does it take for SoftWave to work? What people always want to know. Well, how long does it take? So I come in here, I get this treatment. I don't know, how long is it going to take to notice anything?
Sure, so that's a great question. The number of SoftWaves are dependent upon the area being treated, whether it's a smaller area, medium, or a larger area. Usually takes a few sessions, a few hours to a few weeks, but each session builds upon the previous one. And
But typically, we got something special going on here. So when people come in the office, what is the one thing they notice after that treatment? The vast majority of the people that come into this office, what do they notice after their first treatment here?
Immediate results.
Thank you.
Immediate.
Yeah, exactly. There's not many places or technologies that are available that people can really notice a huge difference in their knee pain, their shoulder pain, their neck, their lower back. We've had a lot of people have said that we've seen here, you're my last hope. If this doesn't work, I'm going to have surgery, or I don't know. They're going to do something bad. Put it that way. So we kind of are that last hope for them, and it's been absolutely incredible to know that we can help them and have been helping.
We don't want to say that surgery and drugs are bad. There's a need in certain areas, but some people are looking for a more holistic route. They don't want to have surgery or drugs, so here we are.
And let's face it, no one wants to have surgery and drugs unless they have to.
Yeah.
Okay, it's not like people tell us, I can't wait to take my opioids, to get out of pain. I can't wait to have surgery to put me back, to set me back even more weeks, months, or even years, wondering if it'll work to begin with. At least in this case, you'll find out if we can help you in less than 20 minutes.
Right.
So.
Yep.
So what does SoftWave tissue regeneration technology do? What's the main thing about it, Sandy?
Well, the high energy sound waves are producing a healing effect, activating the stem cells. Is that what you?
No, but I just want to, just in general, what does it do? SoftWave is a form of what? Lithotripsy, right? So lithotripsy was used in this country, predominantly when, it came into the United States. It was used to, break up bladder stones and kidney stones, right? So just recently in the last, 10 years, less than 10 years, There's been a huge breakthrough in helping people with pain and dysfunction, helping people heal faster, get back to what they want to do faster, get back on the field faster. So this is the world of regenerative technology or regenerative medicine. Okay? So is SoftWave effective? Yes, it is. It's very effective. We can't say enough great things about it. Like you, the audience here, if you're in doubt, come on in. Come in for a consultation exam. It's $48, and that also includes your first SoftWave treatment by yours truly. And we'll see if this is the right modality for you. Have we turned people away to do other things? Absolutely. I have a responsibility to you, but I'm not responsible for you. So one of the things that we do is we'll give you an honest answer. We'll do a very thorough examination using advanced technology like surface EMG, thermography. We'll even throw in body composition analysis, because there's all kinds of factors into helping you get out of pain. And in some cases, even lab and blood work, which is, to cap on, we are having a major fun workshop on Monday, July 8th at 6:30 p.m. where we're going to have the great Dr. Thomas Colton out of Austin, Texas, come in here. He's one of our mentors. He is a functional medicine practitioner, and he also teaches other doctors about how to balance the thyroid, how to treat the thyroid, everything about thyroid, everything about functional medicine, why nutrition is good for you. With whatever you're trying to do in your life to overcome, there's always a nutritional way to do it rather than taking drugs or harmful pharmaceuticals. So with that being said, we didn't get a chance to introduce ourselves, but I just want to say thank you. I'm Dr. Chris Colgan, and this is
Sandy Rocco.
And we look forward to the next time speaking to you again here in the office in another week. And just remember, the body always wants to heal.